Welcome from my side to this traditional and internationally visible, actually, meeting. It's the 28th meeting, actually, and we have a long tradition. We are already looking forward to the 30th anniversary coming up. Welcome to the board members, which are all present. I'm delighted to see this. Welcome to the former presidents. I see your Kesselring. Ludwig Kappos cannot be here. He will be next time. Wish you all the best. And Adriano Fontana, of course. And I would like to say a few things. Adam, thank you for the nice introduction. And I realized that your hospital is one of the top 100 in the world. I don't know how you manage this, but so I read. And of course, I want to thank the program committee who did a great job. And you see all these prominent members with Lara Diem, who has the chair here, Pasquale. Did a great input. Adam, I mentioned Britta, who done a great job, also basic and applied. Jens with the cohort, Iris with the connections to our international speakers. Many thanks. And of course, the president of the Neurological Society, Caroline Post. So we have a prominent and distinguished committee, and I'm thankful already for this because it is a great selection. So it's a light tower, I should say, and this is actually Montauk, and allusion to Max Frisch with Montauk, and this is the end of Long Island with a lot of visibility, so I found this appropriate. We had a great symposium yesterday under the guidance of Britta with a great idea to have the speakers who have had the prizes in the past. We have heard Tobias, Britta, and Jens with great talks, but we have also heard the young ones. We have had the poster flash, which is fantastic. 1 minute, we'll have it today again. You will see it. And we have a prize winner already, Miwako Fujisawa, here on my right-hand side, and it is well-deserved among a lot of competition here with Britta Engelhardt. But we want to go to today's highlight, and I welcome Tanja Kuhlmann from Münster. She will talk about mechanisms of disease progression. She will properly be introduced, of course, and I just want to welcome them. And we have, of course, Cristina Granziera, who will scratch off the surface and then look inside the brain. And she has just been named the department head in the University of Basel. And of course, this will go on. We'll have Menno Schoonheim from Amsterdam, with whom I had the occasion to talk yesterday about methods of cognition. I'm looking forward to your talk, of course. And thanks for coming all the way from Amsterdam, the Academic Medical Center. And then we'll have, I should say, our Andrew Chan, who gives the overview of what's going on, what's an update. He is Vice Dean at the Inselspital. He is member of our board. He's member of the Medical Advisory, and so on and so forth. And he is certainly best suited to give the update. And make sure you attend the poster presentation and the poster flashes I introduced, and make sure you select 2 of the workshops and bring active your question in. The triple P, the digital biomarker, is fascinating. We talked about also in the cohort the future of digital biomarkers. Then the topic with Wolf and Simpson. Then we have fatigue and energy management, very important, the fatigue issue with Weise and von der Weid. And then the complementary and integrative medicine, very much wanted by our patients to be integrated in the state-of-the-art medicine with Ursula Wolf and Robert Fittger. And then when to de-escalate, a very timely topic with Christian Kamm and Stephanie Müller. The year of 25 for the MS Society has been very successful. I want just to name a few achievements. We have had the new move from the old headquarters in Zurich to Fretiken, and you see work in progress with the helmet and of course the new buildings that are really state of the art, I should say. The motto is the house and the compass. This is already the house. And you see the big step of our director, of Patricia, into the right direction. And Martina Tomaschet with the scissors from our board meeting cuts the band. So the resources of the MS Society have been well placed, I should say, in the past many years, and we recapitulated what happened to the careers of the supported people in research, and we found 45 professors in the past, 15 PDs, 30 senior researchers, and the young career starters with 60. So there's a lot of support going in the right direction. You may say this is associative medicine, but I should say it's causal. So, and this year we have approved 14 grants between 50 and 100 Ks, and you see them, very successful groups from all over Switzerland and from all over between basic and clinical and rehabilitation medicine in MS. Of course, we have the support of the MS registry and the cohort, and overall it is now 40 million that went into the research funding in the past 25 years, which is something. And of course, if you translate this as what we fund and then correct it by the inhabitants, we are leading. And this is an important slide, I should say, because it's 2.7 euro per inhabitant that we spend. Of course, we can always do more, I should say, but this is in relation to other countries already an important achievement. And there's more than research also. We have a lot of great services, and this gives you just the numbers, and there's a lot of work and a lot of satisfaction also between these numbers. And I quickly go through the 10 points from bottom up, because the very new is the peer support model, which is very valuable for our patient and complementary. I see Pasquale who fosters this with Claude Vanne and many others, and I think it's great. And I've seen this also in heart failure patients, this model, and this is very, very successful and well accepted by the people with MS. So we have younger groups growing. We have all range of sports. We have, very importantly, the relief for caregivers with the weeks of supervised stays for severely affected, very impressive all over Switzerland. And this is an important endeavor. But also we have more than 17,000 downloads. We have 13,000 participants in events. We have the phone calls incoming of almost 24,000. We have 9,000 patients advised with counseling by the MS Society, and there's more than 10,000 hours spent in counseling clients. Needless to say that we reach more than 1.2 million with our information. So this is an important basis also for fundraising. And if you see what we are doing here, and this is getting more and more difficult, but this is the basis for our work. So coming to the success stories, and there's certainly Jens Kuhle's MS cohort, and this is developing very well. We have more than 20 publications in top journals on this only last year, and we have had the support also, not only from the MS Society, but many others, and certainly a 5-year grant from the SNF, which is also very noteworthy. And so the next guy on the block will be not only the NFL, but the GFAP, and we're looking forward to use this alone in combination, when to de-escalate in combination with Christina's MRI findings and the clinical part. So thanks, Jens. And of course, we should celebrate this year the 10 years MS, the MS registry with Milo Puhan. We have seen yesterday Victor Vonwil with the update, with the increased incidence likely. We see 2 more diagnoses per day of the multiple sclerosis. They have the National Research Program on Gender and MS, very important. As you know, we have a predominance of the females. And many other patient-driven research, speech analysis also very important. And then you see the publications on quality of life and inclusion. And I'm always fascinated also by basic and applied research. And I just want to mention the gut-brain axis, the gut-heart axis. And here is an example, of course, from Caroline Bo and Ann-Kathrin Bröpstel on the gut-brain axis and the gut-heart axis. Will come in a second. And the metabolites that drive the immunity, some bacteria in the gut that give the molecular mimicry, and also some products. And we have been active also in the gut microbiota dependent PAA, and the aging and inflammation of the endothelial cells. And this has, as you will agree with me, some overlap to what we're doing, although I'm coming from the platelet and cardiovascular field. And this is two more. Sure enough, it is important in coronary heart disease, but it's also important, the TMAO, in cognition. We will hear from our guest speaker, and reduced hippocampal volume. And there's also good guys in this, and the omega-3 association with the size of the hippocampus in atrial fibrillation and cognition. And we talk a lot about this in I just wanted to show you the connection between fields and looking outside the border of the plate. And further outside, I just discussed with Andrew John what the neighbors do. And this is an initiative to foster young scientists. It's quite modest, but it's something. And this is another way to get the young people interested in MS. And towards the end, I just want to appreciate the careers and the important steps and the prizes that our scientists have won in the past year. And it's very remarkable. I mentioned yesterday, Britta Engelhardt has had the prize of the MS Society, but also a fantastic, well-renowned ERC grants, among many others. And Cristina has been elected for the head of the Department of Neurology, together with Mira Katan in Basel. Lara Dean has been from our chair this morning in Luzern as attending. Christian Kamm has been appointed to, it's very good for the society to have somebody, to have a foot in the door in the Swiss medic. He looks very serious actually here, but it's part of the deal with the Swiss medic. So, and we have Sarah Mund from Zurich, who has received the MS Society research support, and also the Sobek Young Investigator Award this year. And we can move on. Of course, we have the appointment of Jens and Tobias for neuroimmunology full professors in Basel. And we have Ludwig Kappos, who cannot, unfortunately, as I mentioned, cannot be here this morning. We wish him all the best. Has gotten the Charcot Award at the ECTRIMS this year. There's more awards for him to come, we are sure, and we know. And I want to finish up with our former presidents and tell you two things. As you look at these, number one, they are still very alert. They're ready to comment now in the situation, and critical, and I think they are so fit And I think do research to keep yourself fit and not aging. And this is also true. This is citation of Adriano Fontana after his emerited professorship. The desire to do research will not stop. I found this very nice. And I want to thank the Luana Pellegrini and Katrin Schneider. Without them, the meeting has not been possible and running so smoothly. When you don't see anything that's going wrong, it's got to be a reason, and that's theirs. And of course, our directors who are all here, Patricia and Christoph, have done a hell of a job in the past year. And I usually mention that 50% of their weekends, they're on the road for MS, among others. So a big thank to our directors who run them, and a thank to our supporters that are listed here without support without the pharma. So it's all independent, and this is noteworthy. And I think I want to stop here and give it back to Adam. Thank you very much.